and I'm your friend to the end. Heidi ho. Hi.
Did
I'm
you
Chucky,
miss me?
and I'm your friend to the end.
It's time to play. We're friends to the end, remember?
All right, this is Marc, man, the health advisor. We got an important subject. It's open enrollment, right? It's Obamacare open enrollment. So I figured I'll go live, do a video, and then let it circulate through YouTube to kind of explain what's going on with the healthcare system right now. Um, Obamacare open enrollment. So basically, with Obamacare, a lot of people out there they have lack of coverage or they have limited coverage options or the price of their coverage is going up. They don't know what to do about it. They're worried about, hey, how am I going to afford these new premiums, right? I mean, there's a lot of things that people don't know about Obamacare. Well, that's what the health advisor is here to do, the expert. I'm going to help you understand the basics of what's going on with Obamacare, okay? One of the main things, one of the new wrinkles that have been thrown into the Obamacare pot recently, current president, President Trump, President Donald J. Trump, you know him well, I don't have to get into all of that. Well, he made one major change to Obamacare that's really affecting a lot of how the system is working right now. There was a penalty. It was called the is it the responsibility fee or something of that nature, right? There was a tax, pretty much a tax that was sanctioned through Obamacare for people who did not have coverage, who fit within the Obamacare rules and regulations, right? You were getting hit a tax penalty yearly when you filled out your tax forms, right? If you did not have Obamacare eligible coverage, okay? Which, I mean, a lot of people, some people didn't want that coverage. Some people felt like they were young, they were healthy. Hey, I don't need insurance. They're 20 something. They don't know the importance of having catastrophic type coverage. If they had a job that didn't provide them medical coverage, they just went without. Okay, those people were penalized on their taxes, right? To the tune of, I think it was 6,500 at its max. Who knows, right? Something in that range. What Trump did was Trump said, hey, I want to kill this Obamacare thing. It's horrible coverage. You know his platform. He ran on it, right? I want to repeal and replace Obamacare with something that I deem acceptable or the people who support me deem acceptable, which we never found out what that was. Anyhow, one thing Trump was right about, Obamacare is, in some cases, terrible coverage, okay? And I'm going to tell you what I mean by that. I mean, in some cases, Obamacare is good coverage for people who that's their only option, right? If it's your only option, Obamacare is, it's something you got to have, right? And those people are the people who don't qualify for Medicare or Medicaid. They're in a situation where they make too much money to get Medicaid. However, they don't make enough money to get a great private plan, or they don't have the health. They have pre-existing conditions. Obamacare allows you to get insurance even if you have pre-existing conditions. If you have diabetes, okay, if you have OCD, you have anxiety, you have severe depression. I mean, America nowadays, it seems like 50% of the people have some type of pre-existing condition. So Obamacare is a plan that would allow you, even if you have some sort of sickness beforehand, you can get Obamacare, have coverage, right? It may not be the best coverage in the world, but it's better than nothing, right? If you have Obamacare, at least you can see a doctor, right? In most cases, or in theory, that's how it should work. Now, a couple of the things that Trump did, he got rid of that tax. He got rid of the fee, the responsibility fee, or whatever you call it, right? The fee that people had to pay if they went away from having Obamacare eligible coverage. You didn't have coverage through your employer that was eligible, that met the guidelines, or you decided, hey, I'm gonna go without health care. You were paying that fee. What Trump did, he didn't get rid of the fee completely. He didn't get rid of the requirement. He didn't change the law. What he did was he made the fee zero. He zeroed out the fee. So instead of paying 6,500, 1,500, whatever that fee was in the past, what Trump did was he made it zero, thus pretty much eliminating the fee. I mean, if you make it zero, nobody's paying it. So guess what? That money went to subsidize the system for people who went without insurance, for people for the shortfalls in the system. It raised revenue that can be used to offset the cost of having Obamacare. You make it zero right then and there, you're losing out on monies, right? Now the system is overtaxed because, for one, now people who are relatively healthy will be like, hey, I don't need insurance. So now they don't have any type of penalty or tax incentive to get coverage, right? Which means that people paying premiums are sicker and sicker and sicker as those healthy people fall off the rolls, right? That's one thing it did. The second thing it did was the monies that were collected from the people who said, I don't care if you tax me, I don't care if you penalize me, because it was more like a penalty. I don't care if you penalize me, I'm not going to get coverage. The hell with Obamacare, right? I'm not doing it. Those people, right? Those funds are no longer collected. It's zero. So now you have a shortfall in revenue that can help support the Obamacare ecosystem, right? So now that's gone. That money's gone. That's what Trump did. So effectively, he's underfunding Obamacare by getting rid of that penalty. Okay, so his plan of destroying Obamacare, where he would have to replace it with whatever he deems necessary, he's that's one way to do it. That's one roundabout way to slowly kill Obamacare. And the way it kills it, if there's less people who are healthy funding the system, if there's less people paying the penalty or no people paying the penalty, right? Now there's a monetary shortfall that is propping up the system. So guess what? With rising health costs, okay, with less money to fund subsidies and less money to fund the monies that have to go towards the medical systems that are accepting this insurance, now you have less companies offering Obamacare related plans. You also have a situation where premiums, deductibles are high. Now, in some cases, Obamacare deductibles are as high as $10,000, right? So if you got Obamacare and the deductible is, let's say, $7,000, that means in most cases, you have to pay $7,000 per person. People don't understand this. It's not for one person or for a family. Per person, you have to pay thousands of dollars in expenses, in visits, in if something major happens, you got to pay $7,000 deductible before your benefits kick in. I mean, it's almost like not having insurance unless you have a catastrophic situation. So that is what is taking place for Obamacare. I'm really simplifying it so the average Joe can understand it. But that's where we're at right now. So you say, Mark, what do we do? Well, if you're sick, if you have pre-existing conditions, I've talked to people that are fully healthy, young, people who are older and healthy. I've talked to people who are very sick, and I've talked to people all in between. If you have any pre-existing conditions, the only option you're going to have is, or the only options you're going to have is if you're low income and your state has Medicare available or Medicaid available, you're going to go in Medicaid, right? If you're over 65, you're going to go to Medicare, right? However, if you're in between that, if you're not eligible for Medicaid due to income, or you're not eligible for Medicare due to age, or you're not disabled, where the federal government will provide Medicare services, you're going to have to go to Obamacare unless you're healthy. Okay? So if you have any pre-existing conditions, any medications that are deemed outside of health-based plans guidelines, you're going to have to go to Obamacare, and you're going to have to shop on the exchange to find an acceptable plan. What I recommend people do And a lot of people try to navigate this themselves. It's very confusing. You need to talk to an expert. You need to talk to a licensed agent, not a telemarketer, not somebody who's advising, but they are not licensed in the state that you live. You need to talk to a licensed agent who can help you navigate the plans that are available on Obamacare. Because some states there's like 5 to 10 plans. Some states there's 30. It just depends on where you live, right? You need to understand what you're getting into. You need to understand, are you getting subsidies or are you not getting subsidies? You also need to understand, if you're getting subsidies, what's the pros and cons of that, and how cautious you should be when giving your income information or giving your income totals to get those subsidies. You need to know what the consequences are if you make more money than you state, right? All that needs to be explained to you. And in order to do that, you got to talk to an expert. Okay? This is Mark, the health expert, Mark, the healthcare advisor. That's what I do. I help find you the right plans. Okay? There's also, if you're healthy and you're watching this, there's a lot of healthy people who don't know where to start. Maybe their job doesn't provide health care. Maybe they're self-employed, especially self-employed people. Or maybe they're grown, but maybe their parents pay their bills, right? So they get the coverage, they get the money from their parents, and they pay the bills. Regardless, any of those situations, there's health-based plans out there that save you money and give you great coverage. Okay, so you need to be navigate. You need to have proper guidance to pick the right plan. You need to navigate this web of information to get to the right plan. You need to talk to a licensed agent. I will volunteer to help you. I'll help anybody find the right coverage for themselves. I want to do lots of blogs, lots of videos detailing health coverage, especially now. We're in open enrollment. It started Friday. It started the 1st of November. It's going to run to December 15th. A lot of people don't know Obamacare plans don't kick in until January 1st. So if you sign up for Obamacare, or if you're changing from maybe an employer plan, Obamacare, maybe you got pre-existing conditions this year, something's happened that causing you to go to Obamacare, or you got to find another plan. Maybe you don't meet the guidelines for Obamacare no more. You got to go somewhere else. Obamacare plans don't start. The coverage doesn't start until January 1st, 2020. Okay, you sign up between now and December 15th. It starts on the 1st. You need to seek guidance so you can make sure that you get the right coverage at the right price and it's got the right benefits that meet your needs. Okay. Also, you need to know what the deductibles are. You need to know what the total out of pocket is. You need to know what prescriptions are covered, what doctors take it. Some doctors do not take all plans. So if you have a specific doctor, right, you need to know what plans are accepted by your doctor, by your health system, by your hospital. That's why you need a licensed agent. People try to navigate it alone. I've had many people call me after the fact. It's like, hey, I can't help you at this point. You gotta contact someone beforehand. And that's what I'm doing. If you need information on this, I'm going to do several videos in regards to these subjects. Please call me, 734-391-0611. Call Mark, the healthcare advisor. I will help you navigate Obamacare. I will help you figure out what type of health coverage meets your needs, okay? That's 734-391-0611. I'm also on Facebook. My Facebook page is Mark McLaurin, healthcare advisor. Look me up there. You can also check my website. It's listed in the description below. Seek out help. Our job as licensed agents is to help you find the right solution for your healthcare needs. Not just for you, especially for your family. If you got kids, if you got dependents, if you got family that you're taking care of, you do not want to chance having the incorrect information when it comes to your health or your family's health. Okay? So, in closing, this is Mark, the healthcare advisor, Obamacare. And somebody might say, hey, why did you call Obamacare dying? You're reaching. No, Obamacare is dying for the facts that I laid out. The funding mechanism for Obamacare is being slowly stripped away with the lack of the penalty, okay, with the lack of the fees, right, that were set through the tax code, with the lack of young, healthy people feeling the need to go into it. So it's only a matter of time before the costs get outrageous. If you don't have subsidies, if you don't make minimal income where you can get subsidies for you and your family, you're going to pay outrageous premiums, outrageous deductibles on Obamacare. If you're healthy, I could definitely help you. If you're not healthy, the options are limited until after the new year when plans become available that don't compete with the Obamacare open enrollment window. So either way, talk to an expert, find out what your options are, and we're going to help you the best we can to get you in a situation where you can be covered. Okay? Marc, the healthcare expert, Marc, the healthcare advisor, 734-391-0611. Call me 24/7. If I'm not there, leave a message. I'll get back with you. If you have any questions, send them to me, man. Go to the website, go to my Facebook, let me know what you think. And what I'll do, I'll write your questions down. When I do another one of these live broadcasts, I'll make sure that I answer whatever questions I got from you. Okay? This is Marc, the healthcare advisor, signing out.
Hi, I'm Chucky, and I'm your friend to the end. Heidi ho. Hi,
Did you miss me?
and I'm your friend to the end.
It's time to play. We're friends to the end, remember?